Hello, everybody. My name is Dr. Amir Abbas. I'm an epidemiologist by my training, and today I'm going to talk to you people about the situation currently globally related to the COVID-19 pandemic. Though I will be coming live frequently, as I was waiting that this group gets a reasonable number so that we can have some interaction. But right now, through this short video, I'm going to be talking about some specific aspects of this coronavirus pandemic. So in order to do that, I'm going to share my screen with you people. And as you can see, let me adjust it a bit. Not this way. Yeah, this is better. So this is a global map which is showing the way a typical pandemic will present. As you can see, that you can see cases almost in each and every country. There are approximately 3.8 million infections. Nearly more than 265 people died because of it, and there are a number of aspects of it. And through this video, I want to emphasize a few points. And these are very specific. One, I want to emphasize this number, which is that we have 3.8 million infections. I mean, just imagine what does that mean? 3.8 million people are infected globally. Second is that 265,000 people have already died because of this. Why I'm saying it like this? There are countries which are taking it very seriously, but there are places which is not taking it as seriously as they should have been. So this is one thing which I want to emphasize is that if you know people around you, try to, if they think that it's not a serious problem, there are people, there are minds in the world which still thinks, there are discussing conspiracy theories, which makes me angry actually. So please try to convince them that this is a reality. This is not a joke. Now, the second thing which I want to emphasize, this is a very specific point. I'm not going to be talking long. So I will request you people to please stay with me for some time. If you're listening to this video live or even if you're seeing the recording, please see the video till end because it is going to be a short video. The second thing which I want to emphasize is normally when we're discussing things, the trends in different countries, we are only talking about the absolute numbers. So I'm going to give you a few examples. Let's take an example. We are talking about US. When we are talking about the trends, we just see a graph like this that the number of cases are increasing or decreasing in the US. This is US data, and you can see that there are approximately 1.2 million, more than 1.2 million cases reported, and that's all what we report. And that is a very naive way of interpreting the statistics. There are two things which you need to consider when you are interpreting these numbers. One is how many tests have been conducted uh, per million. So if you can see that US has conducted approximately more than 24,000 tests per million. And the second thing which is important is the number of infections per million, because the absolute number is meaningless if you do not take the population into account. So I will try to emphasize these two things. One is the infections per million, which means that when you're interpreting these numbers, you need to be cognizant of the population size and convert that absolute number into a number which will take the population into account. And secondly, you need to be careful about how many tests are being conducted in that country. I've given you the example of US. Let me give you a couple of more examples from the developed world, and then we are going to go to the developing countries. So quickly, if I talk about Spain, I think they have done more than 41,000 tests per million, and their infections are 5,400, a bit more than 5,400 per million. Similarly, if you go, let's say, to UK, they have done 21,000, more than 21,000 tests per million, and the infections are nearly more than 2,900 cases or infections per million. Now I want to go to some developing countries. Let's talk about India first. So when I talk about India over here, you can see the trend is increasing, and this is not very good. But if you go into the numbers, and if you see that how the government is responding, the number of tests per million, even we have gone quite far in this pandemic. There are months, uh, and still the number of tests per million are 925. As I've shown you that there are countries which have conducted approximately 40,000 tests per million. Now, when you do not conduct tests enough tests per million, then what you are doing, you are not detecting the disease actually, and obviously your number will be low as compared to the rest of the world. So what happens that the governments are claiming that we are doing very well, that they will say, the Indian government will say that we have 52,000 cases, they are not very much, and we are doing well. On the other hand, like they need to take into account how many tests are they conducting per million, which is 925 per million, which is almost uh, I will say it reflects non-seriousness. Seriously, and let's go to Pakistan. When we talk about Pakistan, okay, here you can see that the trend is increasing. I think there is some time there. I mean, the overall trend is not very good, but here you see like situation is not very good. Though the number of what when you talk to government officials, because they are not public health practitioners, because they are not uh, uh, epidemiologists, they do not have an acumen to understand epidemiology. So they what they do, they say, okay, our numbers are lesser than the rest of the world, but they do not, in this doing this analysis, they do not bring into consideration the number of tests which are being conducted per million, and at the same time, uh, and they ignore this number, and it's quite annoying when you make policy decisions on just being so simple and being so naive. I do not understand how can someone in the government officials say and claim that they're doing well. They're not doing well because you are just not performing any tests. There are countries in the world where performing up to 40,000 tests. Okay, we understand that Pakistan and India have financial problems, but like conducting 1,000 or 1,100 tests per million, it's being like careless. It's being ridiculously careless. So, from a public health standpoint, I think both of these countries need to enhance the capacity to conduct the tests as soon as possible, because otherwise there will be a catastrophic situation. The second thing which I want to emphasize right now, I do not have an objective evidence on this thing, but I'm hearing from reliable sources that the infection among doctors and health professionals is increasing to dangerous levels. And if that happens, then I'm not sure what will the government of Pakistan or government of India will do. What they how are they going to manage this pandemic if the number of people, the doctors, are going to be killed because of COVID-19 pandemic? I'm hearing every day, every other day, we hear that one or two doctors are getting killed, and that many of them are getting COVID-19 pandemic. So one thing which government needs to do right now on priority basis is, no matter, like there is no argument which is going to be accepted at this point that you do not have resources. You have to mobilize resources because you are in a war like situation right now. If you do not mobilize resources, you mobilize resources in a war. Okay, you do not say in the war that we do not have resources. This is a war like situation. You have to mobilize resources. And the second thing which you need to do, the first thing, you have to mobilize resources for increasing the capacity to conduct the tests. And the second thing which you need to do is to provide the PPEs, the protective equipments for your doctors. If you're not able to do this, then catastrophic consequences are waiting for you people. And I do not have anything else to say right now. If you have any comments right now, I didn't see any comments in the live video, but if you have any comments afterward, I will be recording, seeing all the comments. Obviously, like we are starting these videos, so I'm anticipating that there is not a lot of live participation right now, but I'm hoping that this participation will increase. And the reason I'm emphasizing on the comments, to please give me feedback on the way this information is presented. I want to present it in a way that I want to bring these points across so that they're heard and they're brought up to the decision makers. And so I need your comments as feedbacks. So how can we ensure that we communicate these facts in a way that it matter? Um, I will just pause for like 30 seconds to see if there is And there are any comments from the live discussion, I'm going to, because I'm using a software and there is always a lag. So I'm just going to pause for to see if there is. I'm going to check it in my mobile phone to ensure. Then there is some. Think I'm not seeing any comments right now, so I'm going to sign off. That's all my message to the Pakistani and Indian government, that please increase the capacity of doing tests and please protect your health professionals, all those stuff. But when I mean health professionals, I'm talking about doctors, paramedical staff, and everybody who is working in hospital and everybody who is working, even talking about and the hospital staff and even those people like the policemen who are working and they also need protection. So all of those who are frequently exposed to this needed to be protected because it is the need of the time. Take care for the time being. Remember me in your prayers, and as I will repeat, I will be waiting for your feedback. Have a good day.